Hello friends, nowadays many patients are suffering with blood pressure, even young patients. That's why regular BP checking is very important to keep yourself fit. And BP checking manually is most reliable than checking blood pressure through any digital machine. Checking BP is a technical task. You don't need to be a doctor to check BP. Anybody can check BP if the science behind the blood pressure is minimally understood. In our circulatory system, heart pumps the blood through arteries with its contractions and relaxation. During contraction, heart pumps out the blood through the arteries and creates the pressure on the walls of the arteries. That is called systolic blood pressure. And in between the contractions, when heart is relaxing, so that time the minimum blood pressure which is maintaining in the artery, that is the diastolic blood pressure. So usually for checking blood pressure, two techniques are there. One, checking the blood pressure with feeling the pulse. Another, checking the blood pressure with the help of stethoscope. So how you feel the pulse? If you see your thumb, it is just coming at this level, just behind the wrist. You put your fingers and give a pressure and try to release slowly, and you will feel the throbbing. That is the contraction of the heart, what you are feeling through your pulse. So when you are slowly increasing the cuff pressure, at one particular moment, the pressure is reaching at that level where the systolic, the maximum pressure is there, where the blood flow will stop and you will not feel pulse here. So that's the systolic blood pressure. But the diastolic blood pressure, you cannot check through the pulse. You have to use the stethoscope. So let's see how to check BP. You need a BP machine, manual BP machine, which is also called sphygmomanometer, and a stethoscope. First, tie the BP cuff properly around the arm without any foldings. You can see these two tubes, two green tubes. Keep these two tubes in front of the elbow. Now you feel the pulse. Already I told you how to feel the pulse, and start inflating the cuff and watch the mercury column. You can see mercury column is going up and you are still feeling the pulse. At certain level of pressure, suddenly you will not get the feeling of the pulse. Now slowly release the valve and release the cuff pressure. Mercury column will start coming down, and one particular level you will again start feeling the pulse. So that's the point where it is called systolic blood pressure. Now confirming the systolic blood pressure, keep the cuff inflated and put the stethoscope at the elbow and start listening the sound of the pulse through the stethoscope. And now start inflating again and see how the mercury column is going up, and at certain level where systolic blood pressure was felt through pulse, you will not get any sound in the stethoscope at that level. So that is confirmed, that is the systolic blood pressure. Again you start deflating, and at the same point again the sound will come back. So systolic blood pressure is confirmed. Now you keep deflating very slowly and let the mercury column come slowly down. You keep on getting the sound of the pulse. You keep coming. The mercury column is coming down, and a particular level, again the sound will disappear. So where the sound will getting disappeared, that is the point, there is the lower point which is called the diastolic blood pressure. So you will not get any sound below this diastolic blood pressure. That is the lowest arterial pressure. So these 2 points where the pulse sounds are disappeared, or other way can be told the upper and the lower range where you are keep on getting the sounds of this pulse in the stethoscope are the systolic and diastolic blood pressure. Keep practicing regularly. It's very easy. You can give accurate feedback to your doctors about your blood pressure. Thank you.